Today I will summarize what we hear in the in my session and Dr. Kenneth session. So I used the picture I captured from the medical journal to link to what we talk today. The first, we talk about how to evaluate inflammation. So the modified Glasgow prognostic score is an example to use to evaluate the inflammation status. And the second, we know that COVID-19 is abnormally in immune system. It is over-respond and causes cytokine storm, causes serious inflammation, and then organ damage. So the immune system is very, very related to long COVID also. And what causes or make the long COVID syndrome more severe? The first, the inflammation. We have very clear data that inflammation linked to the disease pathogenesis. And then we hear about the role of metabolic implication of oxidative stress, from oxidative stress to inflammation. So it causes the progression of SARS-CoV-2 and then the severe COVID-19. And then we hear about the role of vitamin D, because vitamin D is a vital part in immune system, especially for the working of macrophage. The picture I capture from the medical journal, it is clear. I try to show about the evidence base. Let me talk about the oxidative stress and the response to the aggression of COVID-19 and the role of active glycation end product. The glycation end product, the advanced glycation end product, AGE. Hyperactivation of AGE causes hyperactivate of receptor of AGE also. So this link to many comorbidity and also act as a risk factor for the severe COVID-19. And the word immunosenescence. Immunosenescence is like the word senescence in terms of aging medicine. It is like if some people age 50, his white blood cell, his immunity, his NK activity, naturally like people who have age of 70. This is easy explain of immunescence. Many causes our body's immune aging more than our biological age. So this is an example of the effect of immune senescence. And then the involvement of COVID-19. We have heard a lot. COVID-19 involved respiratory system, causes respiratory failure, but COVID-19 also impact to the nervous system and also involved in the cardiovascular system. We have strong report from science journals and many landmark journals. And Dr. Kenneth talk about herpes simplex reactivation of the many virus, especially the herpes family. We have the data published to the link of COVID vaccination to this reactivation of this viral. This is the samples of what is the reaction from the paper of the dermatology. This is the pictures of the patient. And we have a study to link with the herpes social reactivation to the mRNA vaccine also. And this is the paper from the landmark journal Nature and BMJ that show the long COVID heart problem. If you read this kind of article, you will see the very big impact of the long COVID to the cardiovascular disease, because most of people die from cardiovascular disease, and now we are in the aging society. The common comorbidities of the aging people is the metabolic and then cardiovascular. That is an effect of the long-term metabolic problem. So this kind of the comorbidity in people who have infected with COVID-19 will make our doctor to be more duty in future. And this is the summarize about the involvement easy to remember where there is H2 receptor, then there is involvement by COVID-19. This is the long COVID samples of the diagram from the BMJ. This is the like a guideline used in UK. And we talk about the role of vitamin, the vitamin C and zinc, vitamin and other kind of vitamin. Some paper is positive, some paper is negative. And we also, but for the high dose vitamin C given intravenously, we found a lot of positive paper, but there is a few, there is a very low sample size. We need more research to make us, to make sure for the real effects of the high dose vitamin C. But most of all this kind of treatment has very, very low side effect. So you may try to integrate to your practice. And we talk about vitamin D. So we show the data that the level of vitamin D before infection relate to severity after infection. So it is better to check vitamin D level and supplement, or if you could not check, to be supplement to try some occasion to got the sunlight. It is recommended. And then we talk about the role of proteolytic enzyme, especially the bromelain, the protease, in term of the infection and in term of COVID-19 also. We have for the traditional Chinese medicine, WHO just talked and discussed for this topic in this month. You can see this information in website of the WHO. I pick up a little summarizing this slide. And we talk about the NK cell. You may have heard that our immunity have two components, the innate immunity, rapid response, but little effects, and adaptive immunity, slow response, but very, very effective. So where is the NK cell? NK cell fall in between. NK cell itself have ability to kill infected cell, cancer cell by its grandson. It is like an NK cell weapon. After they kill that cancer cell, that viral infected cell, they also release the cytokine to trigger or tell to or send a signal to adaptive immunity to do the rest of the work specifically. This kind of cytokine is named interferon alpha. Interferon gamma. So we can check the activity of NK cell by checking of the amount of interferon they release, or checking the activity by let NK cell destroy cancer that was fluorescent. We can check the fluorescent cancer cell line, how many cell was destroyed by NK activity. So we have two ways to test. In Thailand, we use both methods to test NK activity. When we know the activity, if we found our patient have the low NK activity, we need to improve. One way to improve, we may use BioBrand or MGN3 or arabinoxalan to enhance the activity of NK cell. We have a lot of paper to support. And we also have the paper in complementary to cancer treatment. And we have a paper to show that NK cell activity was augmented by BioBrand. And then we talk about the natto kinase and NKCP. This is the picture of what is NKCP. It is like this. Its mechanism, it is act like a blood thinner. You may use it to substitute, or you may use it to add on, or you may use it before, because it is more natural. So you may use it as a supplement, but you have to aware about the risk of bleeding. So try to tell the patient, your client, every time that NKCP should not, it is like if you take NKCP, you have to tell your doctor who prescribed cardiovascular drug to prevent more drug because it may cause bleeding. We have the paper also to support the use of nattokinase, whatever the natural form, or the NKCP, the modified form of the nattokinase. Then I want to give some take-home message about what we talked in the long COVID session today. The first, immunity played a major role in infection, its complication and long-term outcome. We need to improve, we need to keep our immunity, especially NK cell activity, in balance. The NCD, like obesity, diabetes, chronic kidney disease, and also the psychiatric problem also increase the risk of post-COVID health problem. Inflammation causes immune compromise, so we need to check immunity. We need to stop or decrease or eliminate the cause of inflammation. Nutrition and lifestyle is very impact. Before take any supplement, please manage your nutrition, especially balanced diet. And please take time at least 30 minutes per day, 5 days per week for aerobic exercise, because this increases your physical activity. Healthy physical activity brings healthy immunity. And gut dysbiosis may be related to inflammation. I think in the next session, because next year, even next 2 years, COVID-19 still be with us, the topic of gut microbiota, gut dysbiosis will be concerned. And post-COVID, checkup and management should be established in every hospital, because it is better to bring people at risk to personalize the special program, because patient different risk by risk, people by people, genetic by genetic. So we may need to develop some kind of score to use. And don't forget to treat underlying disease altogether. And don't forget to check immunity profile. Immunity profile should be innate immunity, such as the NK cell count and NK cell activity, and also the adaptive immune site like T cell count or T cell immunity. And also micronutrient check, especially vitamin D. If low, please replenish. And the role of immune enhancer to be added, because you see in the slide that for healthy people, low dose of the rabinoxalan can keep immune in healthy status. But for disease like cancer, for disease like who have frequent infection and influenza season, we may use the higher dose of the rabinoxalan. And also microbiome checks and rebalance. In Thailand, we also have the lab to check the microbiome. We check what is the genus, what is the families of the bacteria in your bowel. And the last, we may cure acute COVID, but not for the long COVID. So we need a lot of knowledge. We need a lot of cooperation. We need a lot of sharing of the experience. So after this session, if any attendee have any question, you can ask in this live question, or send the question via the social media channel or online channel. Thank you everyone to attend. Thank you.